Stroke: prevention, recognition, and treatment.
What is a stroke? A stroke is a brain attack, also known as a CVA or cerebral vascular attack. It occurs when blood flow to an area of the brain is cut off. When this happens, brain cells are deprived of oxygen and begin to die. When brain cells die during a stroke, abilities controlled by that area of the brain, such as memory, speech, and muscle control, are lost. How a person is affected by their stroke depends on where the stroke occurs in the brain and how the brain is affected or damaged. As a nurse that works on the cardiopulmonary unit, I see strokes on a daily basis. I see the lasting effects that it has on not only the patient, but also family members. There are two different types of strokes. There are ischemic strokes, which account for about 87% of all strokes. This occurs when a blood vessel carrying blood to the brain is blocked by a clot, also known as an emboli. This causes blood not to reach the brain. High blood pressure is the biggest risk factor. Ischemic strokes occur in two ways: an embolotic stroke and a thrombotic stroke. The other type of stroke is a hemorrhagic stroke, which accounts for about 13% of all strokes. This is the least likely to occur of the two strokes, but often results in death. A hemorrhagic stroke is either a brain aneurysm first or a weakened blood vessel. Blood begins to spill into or around the brain and creates swelling and pressure, damaging cells and tissues in the brain. The two different types of hemorrhagic strokes are cerebral and subarachnoid.
Recognizing a stroke is extremely important to recognize the sign of strokes because early treatments can be limited in brain damage and vastly improve outcomes. There is a limited window of time for intervening with the treatments to prevent the brain damage and disability. Patient is often alive at the hospital after the window of opportunity have closed. For example, for ischemic strokes, they have a window. The time frame is from the recognizing symptom to treatment. It all have to be happen within 4.5 hours. Most of delay is in most of people is recognizing symptom in calling 911. So we're gonna see what kind of symptoms have. It has the we call the FAST. This acronym is the F is the face drooping, A is arm weakness, S is speech difficulty, T is time for call 911. And another additional symptom has the it can appear to separately or it can combination with the fast sign. So sudden numbness or weakness of face, arm, and leg, especially on the one side of the bodies. Sudden confusion, trouble speaking or understanding, and sudden trouble seeing in one or both eyes, and sudden trouble walking, dizziness, loss of balance or coordination, and sudden severe headache with no known cause.
Let's talk about stroke prevention. Prevention includes having a healthy diet that's low in fat and high in fiber, avoiding illicit drugs, exercise, maintaining healthy weight, controlling diabetes, and quitting smoking and alcohol intake. Modifiable risk factors. These are factors that you have control over in your life that you can change to reduce your risk of stroke. These include things like hypertension, smoking, diabetes, atrial fibrillation, other cardiac diseases, obesity, physical inactivity, poor diet, alcohol use, drug abuse, hormone replacement therapy. Again, these are factors you have control over that you could change to reduce your risk of a stroke. Non-modifiable risk factors are things that you cannot change about yourself that could reduce your risk. These include age, sex, race or ethnicity, and family history. A preventative diet Changes in diet can greatly decrease the risk of stroke. The goal of a stroke preventative diet is to decrease your intake of sodium, trans and saturated fats, and cholesterol, and then increase nutrients to prevent your stroke, like fiber, to help reduce cholesterol intake and promote gut health, as well as potassium for heart health. The DASH diet is a good diet to follow to reduce risk of stroke. DASH stands for Dietary Approaches to Stop Hypertension. Hypertension, or high blood pressure, is a large risk factor for stroke. The goal of this diet is to help lower your blood pressure. Reduced sodium intake and promotion of healthy foods will help lower that blood pressure. Consuming less than 2,300 milligrams of sodium daily keeps your blood pressure down. What to eat? Foods. These food groups include protein. You want less than 6 servings a day, preferably from low-fat meats like fish and poultry. Also beans, nuts, seeds, and legumes. Dairy, you want 2 to 3 servings daily. Choose low-fat or no-fat, calcium-rich dairy products. Whole grains, 6 to 8 servings a day. Fruit, 4 to 5 servings a day. Eat a variety. Fresh, frozen, or dried is okay. Vegetables, you want 4 to 5 servings daily. Same thing, eat a variety of these, especially dark green and orange vegetables. Eating well after a stroke. If you have already suffered a stroke, eating well afterwards is a key to recovery, and choosing the right food groups can help to reduce blood pressure, maintain a healthy weight, and reduce risk of another stroke.
So why is it so important to rush a suspected stroke patient to the ER? It's because we can't do anything to improve the patient's outcome until they arrive at the emergency room, until they arrive at the hospital. Timing is everything. Once the patient has arrived at the ER, they will be diagnosed through the use of a CT or MRI scan. This tells us if the patient is suffering from a stroke as a result of a clot that forms a blockage that prevents circulation, or if the patient is suffering from a stroke as a cause of a bleed or hemorrhagic stroke. Now, if the patient is suffering from an ischemic stroke or a clot, the gold standard drug used to treat this is called ATP lipase. This is a miracle drug because if given to the patient within 3 hours, and in certain patients up to 4.5 hours, this drug can actually go in and help restore circulation to the brain, and thereby it will actually prevent the patient from suffering deficits as a result of a stroke. Treatment for a hemorrhagic stroke or a brain bleed is surgery, and whether a patient is suffering from a stroke as a result of a clot or a bleed, getting the patient to the ER means everything. Now, after the patient's left the hospital, they will go to a rehabilitation facility. These rehabilitation facilities are armed with a team of professionals to help the patient to recover. The team of professionals includes physicians, nurses, occupational and speech therapists. Each of these professionals plays an integral role in helping the patient to restore function as much as possible. Physicians oversee the care, and nursing helps the patient to receive their medications and helps to reinforce education and instruction given by the healthcare team. Occupational therapists will help the patient to learn new ways of carrying out activities of daily living. A patient who has severely suffered from a stroke may have complete loss of function in one side of the body. In these cases, occupational therapists mean everything because they help the patient to once again learn how to do things with the use of only one side of their body as much as possible. A physical therapist will help the patient by helping the patient improve in strength, and the circulation that is provided by the exercise actually will prevent another stroke. The patient may also be learning to walk again. If the patient has suffered little deficit from the stroke, physical therapy will play an important role because it will help strengthen the patient and prevent falls and recurrent strokes. Speech therapy is very important in patients who have severely suffered from stroke because they will often have swallowing and speech difficulties, and these are addressed by the speech therapist.
Each year, nearly 800,000 people experience a new or recurrent stroke. A stroke happens every 40 seconds. Stroke is the 5th leading cause of death in the United States. Every 4 minutes, someone dies from a stroke. Up to 80% of all strokes can be prevented. Strokes is the leading cause of adult disability in the United States.
To conclude, remember that both types of strokes require rapid treatment. Remember the acronym FAST to help recognize signs of a stroke. And remember that a healthy diet is key to preventing strokes. Timely treatment of a stroke can reduce the severity of the effects and eliminate complications. Rehabilitation can restore loss of function. This presentation has been brought to you by Hiona, Jill, Jeff, and Jared. Thank you.